And we're live on Facebook. Doc Bev, you can start the po. Good morning, everyone. Good morning, Doc Bev, and to all our media partners. Welcome to a holiday media forum, June 24. Joining us this morning is the concurrent director of the Health Promotion Bureau and the Disease Prevention and Control Bureau, Director Beverly Lorraine Siho, to give us a few updates on our COVID-19 response. Good morning, Doc Bev.
Good morning, Nick. Good morning, everyone, to all our media partners. I know it's Manila Day for us here in DOH Central Office, but we're happy to still have this media forum with you. It will be a little bit short, but we hope that we'll be able to answer the substantial questions that you have. And so you can continuously help us disseminate to our public. Okay. Oops, I just need to turn my vibrator. So currently, our country is filled with mixed emotions as we actually grieve with the entire Filipino nation the sad news of the passing of our former president, um, Benigno Noynoy Aquino, earlier this morning. June 24th is also the 450th founding day of the city of Manila. Um, so thank you again to all our media partners for joining us, and thank you for your continuous service. Habang po ang buong mundo ay naghahanda sa magiging epekto ng COVID-19 Delta variant, we at the DOH continuously requesting sa lahat ng ating mga kababayan, national government agencies, um, local government units, private sector, and the public to continuously protect yourselves or mag-ingat laban sa COVID-19. The Delta variant is now emerging as the dominant variant among new cases in other countries. Dahil sinasabing mas transmissible siya kaysa sa ibang variants, no? So 60% more transmissible. Laging pinapaalala ng DOH ang kahalagahan ng ating mahigpit na border control measures upang maiwasan ang tuluyang pagpasok ng variant at syempre pag pumasok po siya, makakakalat siya, no? At ang prevent, detect, isolate, treat, reintegrate strategies naman of our local government units upang mapigilan yung pagkalat ng COVID-19 sa ating mga komunidad. So we want to protect every Filipino against COVID-19. And we always know, no, be the solution is each one of us has a critical role to play. Ang mga munti nating ginagawa, the small acts that we do such as wearing our face mask and face shield, observing physical distancing, washing our hands, and pagsiguro po na maayos yung daloy ng hangin, especially in indoor settings, all of these add up to overall protection, not just of ourselves, our families, but also of our communities. So with all of these, we encourage everyone, hindi tayo mapagod, but let us all continue to do our share so we can look forward to a better normal and merrier days, particularly a merrier Christmas ahead of us. Nick?
Maraming salamat po, Doc Bev. Doc Bev, I'll be going through the questions that were sent here yesterday. From Nika Hanapol po, her question, how soon are we considering mixing and matching vaccines to address the increased transmissibility of this variant of concern pertaining to the Delta variant po, Doc Bev?
Okay. So what is important for the DOH and our experts, first and foremost, is that all vaccines are able to prevent severe disease, hospitalizations, and even deaths. No? So they're in a way equal in that front. And so when we use these vaccines, we also based it on the studies that came out, diba? And so far, what we can be sure of are the vaccines or the trials that we are basing all of our numbers are still based on same brands for first and second dose. No? So overall, we are waiting for results of mix and match studies in other countries. At the same time, our local counterpart, so DOST, PCHRD, so the Department of Science and Technology, is also funding a local trial of vaccine mix and match. No? So regardless if may maunang results na lumabas, we will refer to that as our basis for recommending or putting into policy a mix and match policy. So for now, what is clear is we stick to the EUA provisions, which is still same brand for first and second dose. Back to you,
Thank you,
Nick.
Doc Bev. For the question po of Fred Mendoza of the Manila Times, reaction lang daw po sa sinabi ni Senate President Tito Soto on Twitter sa so-called health experts daw says face shields will remain everywhere. Now I know why the handling of the pandemic is not good and stage is now missing in the administration of the IATF. How can a non-doctor and a non-medical expert like Senator Soto comment on the country's COVID-19 response, and how will the DOH counter his comments?
We respect the opinion of everyone, no, our public, including our policymakers. So we fully understand and respect everyone's opinions. What is clear to us, still from the very beginning, our COVID-19 response is guided by science from PDITR strategies and now our vaccination program. So we have been working with various independent expert groups from scientific and medical fields to ensure that our initiatives, recommendations, and policies are all based on evidences and global practice. And maybe at this point, I would also like to emphasize, no, that when we talk about evidence, there is a scientific process for also assessing evidence. No? So we call it a systematic review or a meta-analysis. No? And with this, we actually assess the whole totality of evidence, not really piecemeal type. No? Now, we will look for one article and that would represent the so-called evidence. So there's a process and our experts are using that process so that we are fair. No? And with this, it also means that at any point in time, the decisions or the recommendations can change, and the DOH remains open to changes. No, if new studies will come out that will significantly alter how the meta-analysis results will be, then we are open. As long as it abides by that process, you can trust that process that it will yield the best or the most correct, no, result or the fairest interpretation among all the studies.
Thank you, Doc Bev. For the second question po of Red, regarding the call of the President to arrest those who refuse to be inoculated is just a passionate call by the Chief Executive. How can we convince more people to get inoculated kahit na alam natin na hindi ito mandatory or a requirement and mataas ang ating vaccine hesitancy?
So what is clear to us, no, as medical practitioners and in the health sector, people have autonomy, no, at the end of the day. So, and that's why they get to determine what medical procedures they go into, etc. We respect that autonomy, but also have the responsibility to continuously inform the general public that this decision has to be done for their betterment and also the safety of the people around them and the entire community. So with that, our efforts are really hinged on strong demand generation through information dissemination activities. And these are not just above the line information dissemination activities or what you would expect traditionally, no, the TV commercial, radio commercials, but it's really a lot of interpersonal convincing. And with that, we recognize that we can't do it alone as DOH, nor as the healthcare professionals alone. No? So all of us, again, have a role to play. Why? No? The data continuously shows us that for people to get convinced or to engage in this dialogue of whether they will get vaccinated or not, a lot of the role is really with people that they trust. No, so it could be medical experts, but it's also as much the doctors or the nurses, the midwives that they know personally, and syempre, no, their family members. So lahat tayo importante, no, may role to play. And so our strategy in the DOH has really been to develop tools to have, say, town hall sessions, for example, training for healthcare workers on how to respond to queries of individuals in the community. At the same time, no, this is just the convincing or the persuasion part. It's also clear to us that on the other side of the fence is making sure that the entire vaccination process is accessible. Meaning, hindi mahirap mag-register, hindi mahirap pumunta sa vaccination center at maghintay ng matagal, and so on and so forth. No? Things that can convince someone who has already expressed interest to get vaccinated na biglang, ay, wag na lang kasi napakahirap. No? So it's a balance of those two parts, and we are working closely with our local government units. And you will see, diba, that each local government unit has different strategies to fix this access part. No? So some of them does pre-registration, tawag nila, bakuna bus, no? It really goes around into the community. Some of them have barangay officials going around doing the registration kasi nahirapan mag-online. A lot of these innovations are actually happening sa ating LGUs, and it is to respond to the hesitancy issues, which are not just about communication, diba? It's also about access. So, yun po yung dalawang areas na pinagtutuunan natin ng pansin ngayon through our regional offices with the LGUs.
Thank you po, Doc Bev. We see the questions here that are being sent here in the chat po. We'll be sending those via Viber na lang po. And for questions on COVID-19 variants and the efficacy of the vaccines against the variants, we'll be having a copy-and session with our vaccine expert panel tomorrow for everyone's reference po. Doc Bev, if you have any final reminders po before we end today's brief.
Thank you, Nick. First of all, we'd like to extend our thanks to all of you for joining us today for a short media forum. But as we continue this fight against COVID-19, our unified responses play a very crucial role in people's trust in our interventions, which we know are evidence-based and scientifically proven. So our minimum public health standards continues to be the base layer of protection for all of us, and add to that the vaccines. So we hope that continuously through our forum with you, we continue to be able to express these critical messages to our general public. So yun lang po for vaccine hesitancy materials, no, or vaccine confidence na materials. We'll be happy to share with you the updated links in our media Viber group so that you can also use them in many of your products, no, that you'll be developing or in your shows, etc. So yun lang po. Maraming salamat ulit and we really appreciate all your support. Thank you, Nick.
Maraming salamat po, Doc Bev, and to all the media partners. Ingat po tayo.